welcome to your deep tissue massage. How you doing today? Okay, well, that's probably why you need a deep tissue massage. So I hope we can get that addressed for you, and that by the time you leave my office, you feel even just the littlest bit better. Now I want to ask you real quick. So what is your idea of a deep tissue massage? I ask this because there is no common definition. There is not a specific modality that is deep tissue massage. Some people think of it like a regular Swedish massage, but more harder equals more better sort of deal. Some people take it with specific techniques and they want to work really deep in the muscle. Oftentimes that means it's going to be a little slower and it will vary from superficial to much deeper, almost trying to access every single muscle we can get to. So what are you kind of looking for in terms of a deep tissue massage? Okay. Absolutely, we can work with that. So I am going to have you get on the table, get all comfy, and we will start your massage. How is this? Are you comfortable like this? Do you need any more draping at all? And how's the temperature of the room? Just let me know if any of these need to be changed so that you can relax as much as possible. Right? So, do you mind if I start touching you for this massage? Wonderful, thank you. Let's see what we've got here. I want to just take a little bit of a feel here. See maybe where we have some areas that are a little bit more tense than others. Right. So I'm going to be pressing on a few places here. Let me know if any of this is painful or tender. Right in here. Okay, and how about on the other side? Up in the neck here. Right, let's come down the spine. Just tell me if anywhere doesn't feel right. Okay, low back. And around the sacrum. And around the hips. Okay, that's all good. Let's come back up. And I'm going to get in the shoulders a bit more. And the arm. Alright, so a few places here that we can work on, absolutely. What I want to start with is going to be some warming of the tissues. We don't want to go in and just start with any deep tissue, but instead we want to let everything become a little bit more pliable, and your body's going to naturally tense up when we start getting into some of these more painful or tender areas. And it's also going to naturally tense up when you have a stranger start to touch you as well. So we want to give your body a chance to get used to it and to start processing that we're going to try to make it better. It just needs to relax a little. And I'm not going to be doing just the classic long effleurage strokes. We certainly have some, but we're also going to be going across and working in circles, working on one side and then the other. Deep tissue massage is an opportunity for us to get all parts of the body area we're working on. We don't want to be formulaic with it. We want to make sure we are getting all aspects. It's going to make it feel like a much more well-rounded massage, as well as better addressing any dysfunction in the muscles and the fascia. You can even get into the joints a little bit. Just doing one side here. I want the tissue to start getting a little looser, a little more limber. Listening in and tuning into some of the little key signs that you might be relaxing more. Some people do a physiological sigh. Some people, you can start to see like the shoulders drop into the table. Some people start breathing slower. Now, some parts of this are not going to feel very much like massage and more like pointed pressure. We're going to be using quite a lot here. So, let's start up top. We're going to get a little bit more of a look here. So, we have a rather big offender right in here, one of the more common ones, and that is trapezius. So that's going to be from right here, the back of the neck, comes over the arm, and then we make this big curve and it goes down the back. And we're just checking this out. Might have to comb through the fibers a bit. So that's going to be our big guy. But if we come into the shoulder here, then we have muscles like infraspinatus and supraspinatus and teres minor here. We have rhomboids, and underneath those we have the serratus, posterior, superior up here, and we've got an inferior lower on the back. We have teres major over here, and we can get a little bit into the lateral chest wall because all of these muscles work together. So it's very important that we kind of check everybody out. So what I want to do here is I'm going to start getting in a little deeper. So I'm going to be using one hand to kind of support here, while the other one just sort of very slowly glides along. Creating space in there. Might be moving your arm around a bit. Good. I can use pretty much all parts of my hand here. Might use the knuckles, the forearm, the elbow. So as I'm getting in here, how's the pressure? Okay, intense but not painful is definitely the furthest we want to go. So do let me know, because once you start getting into the pain range, that's when you start tensing up. And that's when everything we start doing becomes counterintuitive. There we go. And we can get in. We can do some cross fiber as well. Just want to get all angles here. Okay. Just working that back, we're going to work with the scapula. We can move that around so we can get real into some muscles you wouldn't normally. There we go. And just letting the weight of my arm kind of move around, kind of push me forward. We're carving out the scapula here. I can use some targeted pressure with my thumbs, but we're going to want to avoid that because that can put a lot of strain on the thumbs when we could just maybe go in with a knuckle, for example, or an elbow. As we're getting in here, we might hear the table try to pop and click. Good. So I'm going to take your arm. You just let me hold on to this. And let's go ahead and change the shape here. There we go. And then there's even, we open up the lateral part of the chest as well. Might even get into the pectoralis in there. Good. How does it feel here? Strange. Yeah, that doesn't surprise me. This is stuff that you're not really going to work into in a Swedish or relaxation massage. This is more an area you find in body work or in specific massage modalities. Okay, let's go ahead and change a little bit different so we can get, there we go. We can carve out the scapula here even more. There we go, more the medial edge. Good. Let's put your arm back, and we're going to do that on the other side. So we'll start with trapezius. Warm it back up a little bit. So we're trying to unstick these areas. We're trying to address adhesions and restriction. Right, so one hand supports, one hand slowly digs in, moves forward. Good. Nice and slow. If I feel like I'm going a little too fast, then we're going to slow down. I would much rather go slower and melt into the structure as opposed to too fast and get skipping or not hit something as effectively as I'd like. Carve out right in here. Good. Let's get into that cross fiber. We're shifting around these tissues, so naturally this is not something that would occur without manipulation. So we're kind of changing the sensations in the muscles here. We are introducing the idea, the concept of the muscles going a completely different way. And then they're allowed to settle back in where they normally would, but with less of an idea of the holding pattern. And scapula here. Let's see what we got. Yeah, there we are. Supraspinatus right up here. Infraspinatus below that. Teres minor. Come around to teres major. There we go. Just kind of checking everybody out. We have the rhomboids here. Minor on top of major. Or rather more superior to major. Okay. Getting into the scapula. I don't want to push too much here. So we can just move your arm around and get a better way to get in there. Carve a different path. Lateral side a little bit. Alright, so let's see. We're going to put this arm like this, and then we expose that lateral area a little bit better. Good, get a little bit of lengthening in there. Good. Just checking it. How you doing? Yeah. Good to know. Good to know. Right in there. And then bring scapula a bit. We can get really into there. So we'll definitely hit areas like the spine and all those little muscles get inflamed and worked up around there. We're going to hit Latissimus dorsi, of course. That's our other big one in the back that gets all tangled up. Usually, if a layman knows what a muscle is, it's often because it acts up a lot. Especially in the back here. There. Let's see what we got going on. There we go. Good. Good. So let's come in closer to the spine here. We're just gonna marry everything together. Make sure that the body knows that it's all connected. Getting some knuckling in there. Really sink in. Move bit by bit. How's pressure? Good deal. Yeah, I'm really getting in there, so I want to make sure. There we go. Let's see what we got going on with the lat dorsi here. So it is this big sheet here. Latissimus in Latin, if you think of the word latitude, it's the same root. And latissimus is the widest. Not just wide or wider, but the widest. And the sheet covers this big wide area. And it loves getting worked up. Loves getting tangled up. Alright, so let's see if we can maybe work in a different direction. Good. And we'll get into like the sacrum, gluteus muscles a bit, because those are very important. And down here you have like the psoas, for example. There's just a lot going on. Just a lot going on. Okay, let's go ahead and maybe do a little bit of lifting here. This might be a little uncomfortable because this isn't something that this muscle would normally do, right? Get all scooped up. We're just trying to break it up and pull it away, separate everything out. And let's bring it on this side here. So, knuckles. Good. Very slow. On the deeper side. There we go. using my sport hands, kind of letting everything pull. Good. Let's get into some lifting action. Almost feel like a baker with all of this. Not just the kneading, but the lifting and all these different sort of folding, knuckling, these different techniques. It's like we're dealing with a rather tough piece of dough. And we're trying to work it into something more malleable, but not so much that we make it tough and back up again either. Good. And so we have thoracic lumbar, sacrum here, so we're gonna get in the sacrum a little bit because this might take a bit of work. So I'm going to put some pressure in here, like some exploratory pressure. We're not going as deep as we could, not going as long as we could. Just trying to see, is this something that's going to help us out? Is this area a little too tender to start with that? Along the hips here. Right, okay. Let's get in here. Let's see what we've got. And carve out the iliac crest here. There we go. Gorgeous piece of structure. If you've ever seen what the pelvis looks like, you'll know it looks like a pretty complicated piece of bone, and it is. It is complicated. It's got a lot going on. But it looks architectural. In a way, it looks fashioned. It looks very intentional. Rather than, certainly the humerus and the femur, radius ulna, those are cool bones. They are. I like the ends in particular, but they are straight line bones. They might have a little bit of a curve to them. For the most part, pretty simple in design. But the pelvis, right? I feel that way about the rib cage as well. The rib cage looks like an artist rendered it. Looks very, very intentional. Good. How are we doing with how I'm getting in here? This could be a pretty tender spot for a lot of people. Okay, I just want to make sure, because sometimes the knuckles, I'm using more of the flats of the knuckles, but that can still be pretty intense. That's the name of the game, though. Good. So I am going to kind of sit in here for a minute. And you tell me how this feels. Alright, so I'm just going to hold this a bit. very slowly drop a little bit more into it. And I'm going to have you take a deep breath in and out. There, that allows me to sink in more. Deep breath in and out. Good. So I'm going to slowly lift out of here. Good. And let's just come to the other side here. So I'm just going to lean in and incrementally, we're going to just lean more in, just shifting my body weight into this spot right here. Okay. Deep breath in and out. And out. Good. Just go ahead and slowly come back up. We do these deep breathing parts and the pressure. Gotta be careful when we end the massage, because sometimes that puts you in a very deep parasympathetic state, and you can get a little bit of a head rush, or you might be a little too relaxed to balance real well. Alright, so we're going to come in. We have this nice slice right here along the spine that we need to start marrying with the rest of the body. And we worked a lot on the sacrum and the hips, and we'll probably come back, but in the meantime, I just want to bring everybody else together. Good. Back. Good. There we go. And just pull that apart. Good. And you can also go back up. Right in here. Just stretching while I'm using my knuckles to work up the spine. Here we can lift and roll the skin. Create some space here. This one tends to feel better the higher up you go up the spine. A little easier as well. bring that to the other parts. Good. Got anything super exciting going on after this? Yes, we have a real nice group of days coming up with the weather. Let's get into the gluteus muscles here. Kind of work with these. So it's funny waking up and it's 32 or 0 for our metric pals. First thing in the morning. And then you hit around 68, 69, 71, 72 by lunchtime, which is around the 20s, those early 20s. And then at night you just dip right back down. That is autumn in Iowa for sure. You got 4 seasons in one day. You quickly learn to master the art of the layer. The layering. You gotta have an undershirt and a regular shirt and a sweater and maybe a jacket. But it makes the days seem all that much more full. Because you got so much happening even if you do absolutely nothing. I'm gonna bring my forearm in a little bit here. Good. Are you going to be taking advantage of the nice weather we got? Typical Midwest October. Yeah, I think peak of fall color should be hitting soon, if it hasn't already. My partner and I try to, every year, we try to go north up towards, we like seeing the bluffs of Iowa, and we'll go early on in October to see their peak fall color. You have just the swaths of forests and the limestone cliffs, and you see the bodies of water, the little waterways cutting through the landscape, and the ever twisting and turning roads. It's kind of a lot. It gets all goofy till you get up to like Minnesota, and not so much if you're going to Wisconsin. Then it gets worse. But this year, I was having some issues with his car, and it seems to be the engine mounts just wore out. So he's getting those fixed. And then this year, because we missed up north, their peak autumn, we are going to try to go down south. I haven't been much to southern Iowa. I have gone through there to go to St. Louis. I've gone through there to go to Old Threshers Union in Mount Pleasant. But otherwise, I haven't seen much of it. But I'd like to, and hopefully this year we will. Maybe in the future we'll start alternating whether we go north or south. Just bringing everything together. I hope I didn't ramble on too much about that. I'm rather excited. I like any chance rather. I go on a road trip. I don't get to do that very much anymore. There we go. Alright, let's go ahead and bring everything together. So we'll go across. Do our long strokes. Into the side. Focus on one side. Good. We're going to start slowing down. Easing up on the pressure. And just finish bringing it all together. I am going to give you a minute to get reacquainted with the room, and I'll have you sit up, and I'll see you in just a second, alright? Alright, so we're going to take a deep breath in and out. Nice and long. Just get acclimated back into the environment around us. I know that when you've been on the table for quite a while, especially when we've gone so deep into the muscles, that sometimes it can be a little disorienting coming back to an upright position. So just take another deep breath in and out. Good. One last one. Deep breath in and out. Excellent. Do you feel a little bit more grounded? A little bit more balanced? Wonderful. If you need me to help you off the table, I'm more than happy to do that. I'd rather that than you feeling dizzy, and we don't want you stumbling, alright? Okay, so is there anything else I can do for you? Alright. Well, thank you so much for coming in today to my office for this deep tissue massage. I hope you have a whale of a day and a good rest of your night. Thank you.
Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays. But I've done a little bit of everything from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on videos, and exclusive content on Patreon. Or I also have a Ko-Fi link for a one-time donation or a Throne wish list